section 7. First thing I'm going to do is perform hand hygiene and don my gloves. I'm going to verify my doctor's orders against my MAR, and I'm going to verification of the drug, dose, time, and frequency. So we have Zosyn, which is an antibiotic. 1 gram is ordered, and we have our 50 milliliter bag. So our bag is within expiration, and I'm going to check my vial of Zosyn, which is also within expiration and intact. The vial that's being used is 3,000 milligrams over 1 ml, and we have an order for 1 gram, which is 1,000 milligrams over, and that equates to 0.33 ml, and the calculation is 50 mLs over 4 hours, which is going to be our duration of the medication infusion, and we're going to multiply that by our drop factor, which is on our bag, and that's 10 drops per milliliter, and that equates to approximately 2 drops per minute. So the first thing I'm going to do is I'm going to alcohol prep my Zosyn. I'm going to draw up 0.33 mLs. Inject the air. And now I'm going to prep my medication bag. Insert my medication into my bag and dispose of that in the sharps container. We're going to mix our medication, and now we're going to label our medication with the drug dose, the time it's being administered, the date, and my initials and the client's name. So now we're ready to prime our tubing. And I also want to label my tubing with my date, time, and initials. And prime my drip chamber. And I'm going to hang my primary bag below and have my antibiotic up top. And I'm going to alcohol my port. My tubing, connect them, and since my secondary bag is above my primary, I do not have to clamp. Okay. And now that my tubing is primed, I'm going to take off my gloves and put on a new set of gloves after I do my hand hygiene. I'm going to assess my IV site. I'm going to make sure that there's no phlebitis, no tenderness, redness, erythema, or swelling. I'm going to also check for any infiltration, coolness, wetness, 2 drops per minute. And at this time, I'm going to continue to infuse my medication. You want to make sure that your patient is not allergic to any type of penicillin or cephalosporins. So it's very important to ask before you administer. You want to always reassess their history of allergies as well. I'm going to monitor my infusion, and when I come back, I'm going to check my medication. I'm going to perform hand hygiene again. I'm going to don my gloves again, and I'm going to disconnect my tubing. I'm going to alcohol that. I'm going to alcohol that and alcohol my line, and I'm going to put an alligator clamp on my tubing so it's ready for the next administration. And I'm going to adjust my primary bag. And adjust my previous flow rate to what my physician had ordered, which was 8 drops per minute. Okay. And again, I'm going to reassess my IV site for any swelling, tenderness, redness, or any phlebitis or infiltration. I'm going to document the amount of fluid that was infused in my MAR. I'm going to document my medication. I'm going to document the dose, the route, and the amount given. And I'm going to document the time and day that it was given. And I'm going to also document how my IV insertion site looks. I'm going to document my patient response and any instructions given to my patient.